Hey
Hey
Josh, how you
everyone.
doing?
Good. How are you? This is Josh Silver,
Good.
founder of Pulsed Energy in Los Angeles. I have with me today from Better Chiropractic in Gilbert, Arizona, Dr. Brennan Bates, Dr. Will Curtis. What's up, guys?
Hello, hello.
Good
How are
morning.
you?
Doing well. Doing well. We're excited to be on here with you. We've PEMF's fairly new to our clinic, but we've had some really good results, and we're more than happy to be a part of this and be highlighted this month.
Thanks for joining us, and I'm grateful that you guys did. It's a good place to start off with. Is tell me your PEMF story. I know to a degree how you found out about how you got involved, but the rest of the world wants to know, how'd you guys discover it? What was the process? What was that like?
You know, as a sports chiropractor, anytime I go to a seminar, I'm always kind of looking for things that kind of give us an edge, things to kind of help us with our patient base to help them get better results. And um, PEMF, pulse electromagnetic field therapy, has been something it's been around for some time, and I've always kind of heard it and heard different mixed results from different clinicians. And so at those different seminars over the last probably 5 years, I've been looking more into it and tried lots of different brands out there. And some of them I was felt like it didn't really notice any difference. But when I used your guys' machine, I think it was a year ago from this past December. So probably about a year and a half ago at the Pro Sport Chiropractic Seminar there in Vegas, we were introduced to your guys' machine, and right away I could tell it was different. I could tell that it went right to my areas of pain, and it really got me seriously thinking of not only how my patients could benefit from it, but me as a clinician could benefit from it to help me with my
So
own.
so you hit on like the one of the best points that I hear out there from end users, and I just want you to just talk about that a little bit more. Is I tell people that our machine is stronger, but strong doesn't mean painful or more intense. It means more going directly to the spot and feeling it deeper. Is that what you guys experienced?
Yeah, that's exactly it. Is, with these other machines, I feel good, I feel more relaxed, but I would never feel it going right to the area of pain. And with your machine, right away, I could tell it was different.
So then you guys brought it in and did a trial run in the office, basically. Yeah. Just test it out on some cases and see what happens.
Yeah, we had an opportunity. I don't think everybody gets this opportunity, but because you were out here playing softball, you were able to bring a demo unit by. And we had the opportunity for a few weeks to use it on ourselves and to use it on our patient base. And we knew pretty early on that we were going to end up buying one because it was not only very effective for ourselves and what we used it for, but we had a handful of patients that we offered complimentary care for a few visits, and the results we saw with them was really awesome.
So that is awesome. And you actually brought up another point I wanted to bring up is we always talk about the patient cases and things like that, and we're going to get to it. But a lot of people don't realize out there that the practitioners, you guys, the owners, you use the machine for yourself too. And so both of you guys, just if you don't mind, just talking just a little bit about, have you used it for yourself at all? What have you experienced personally as opposed to, all the patients you guys are working with?
Yeah, and that's something that was really big. Between us, we've got two good shoulders. So he's got a good left shoulder, and I've got a good right shoulder. But both of us struggle quite a bit with shoulder pain problems, and it's something that we're doing our constant rehab. But working on bodies 24/7 is just not so friendly to your own. So that was, for me, my left shoulder. It barks at me by the end of the week. Side posture and big folks, and just doing a lot of the physical manual labor that we do, working on bodies.
Yeah.
And so, by the end of the week, I'm putting KT tape on my shoulder. I'm asking to get adjusted. I'm getting massages. I'm doing a lot of things, and it's kind of this rinse repeat cycle of pain kind of near the end of the week or that second portion of the week. And so once we got that demo unit, again, like Dr. Bates said, we kind of knew pretty early on that it was going to be something that was going to be a great addition, not just for the patients, but really for us. Both of us found huge benefit because I stopped having to put tape on my shoulder second half of the week. I stopped thinking about it quite often. And so here I am going multiple weeks in a row. and my shoulder hadn't been bothering me again. And that's really the only variable change in the equation that I'm doing on my day-to-day weekly treatments is I added in PEMF, and now my shoulder doesn't talk to me. And so clinically, it's been something that it's been so awesome for me, because I feel like it's going to add years to my capabilities to be a doctor and provide, you know, I want to be able to work on people really hard, really heavy. I mean, that's really something that we're doing a lot of soft tissue work. We're doing a lot of grafts. We're doing a lot of these other therapies that are just physically demanding for the practitioner. And so being able to feel better myself and be able to continue to do that type of level of care, it's been awesome. And that's just really something that's been really exciting for me, because I feel like it's going to add years to my clinical capabilities, which is really exciting.
So outside of being clinicians, we're both fathers, we're both husbands, and we both have a life outside the clinic. And so not only is it important for us to feel good and be able to work on our patients, but I love pickleball. I want to be able to go out and play pickleball.
We were talking about that.
And that limits you, you know, and Dr. Curtis is very active, and there's things that we want to be able to do as well as work on our patients and not have pain. And so from a clinician standpoint, definitely improve the quality of work, not have as much pain or discomfort, being able to treat our patients the way we want to, but then just quality of life outside of work, being able to do those things with our kids and our families and our friends, that makes a big difference. And PEMF's been a big deal. You know, after, I think by my third treatment, I was really doubting whether or not this was just a placebo effect or if I really was feeling that much better. By my sixth treatment, I couldn't deny it. It was like, no, this is legit. It's not just on research showing that it's effective. I'm now seeing it for myself, how effective it is, and excited to be able to share that with patients.
I'm excited that you guys shared that. I got to tell you, because what you guys just described is what I try to tell people that I could never put on a website or on a brochure, or you'll never experience in a television ad or anything, because there's just not enough time to explain and understand how it works on the individual. And you guys just did a fantastic job of that. It's a proof is in the pudding type of technology, which that sort of leads me back to where we started. Is I know you guys have already seen a bunch of different success cases. So when I say this, what are the first two maybe best results that you guys have seen with the machine so far? When somebody runs into you and says, hey, what did you experience with PEMF? What are like the top two things that you guys have seen?
Well, for me, it comes back to shoulders again. You know, a big one that sticks out in my mind was the first couple of weeks we had the new device. They had a Medicare patient come in. She was picking lemons off of her tree, and her shoulder, she partially tore her rotator cuff. And so she went and saw the orthopedist. They had rotator cuff surgery scheduled, a whole host of pretty invasive procedures on deck. And so I thought, well, let's try a couple of sessions in PEMF and see if we can at least quiet down some of the inflammation, pain, get a little bit of functionality back, improve their range of motion. And by her fourth visit, I mean, she comes in, she can hardly abduct her arm, flexion is highly limited, internal rotation is highly limited. I mean, she had functional range of motion limitations galore, a lot of acute pain. I mean, she really wasn't using her arm when she was getting dressed. She was kind of hiking, you know, her shirt over. And by her fourth visit, I mean, her range of motion was full. I mean, she was able to cancel her rotator cuff surgery. She was able to cancel a lot of pretty big invasive procedures, and functionality-wise, her range of motion came back, pain completely reduced, and she didn't have to have any of those downstream, pretty intense medical procedures. And that was, I mean, I treated her a total of, I think, 6 times. So I thought that was just awesome. Something that was really amazing, to not only give her the results she needed, but also be able to skip all of those bigger, more expensive, you know, and just, it's a lot to rehab a shoulder. They're not easy things to have work done. And so there's a lot of things that can get pretty complicated and messy after the fact. And to be able to avoid all of that and get the result was pretty huge. And she was unbelievably appreciative. And I mean, she's been singing PEMF's praises to everybody she knows. So that one really sticks out in my mind as something that was just, not only did we deliver, but we were able to avoid all of these other things. So it wasn't just the good; it was like a compounded good. So it's just something that was an awesome win clinically, and it was really fun for me to see.
It's awesome.
We've seen lots of people with sports injuries that get better much faster. We've had a gentleman that did a lot of motocross. He had a compression fracture in his spine. We were able to get him back moving quicker. Two of them that really stand out to me, and there's been a lot, so in a short period of time that really stand out, like, man, that made a significant improvement. Two of them that stand out to me is one of them, he had a tibial plateau fracture that he had to have surgery on, and he couldn't bear weight. And he was out of work, not able to work and provide for his family because of this injury. He works in the construction field and couldn't climb ladders and couldn't do a lot of things. And so being able to get him in there and help speed up that recovery and healing process from his surgery to get him back to work was huge. You know, in a lot of different. So from a life, being able to provide for his family, being able to do what he needed to do. And then I had another patient, which this one was pretty interesting. It wasn't as straightforward as I would have thought. She was a nurse, and when she got COVID, she got that long haulers COVID and started having a lot of cognitive issues where she couldn't compute and calculate proper medications and injections. And so she had to stop working. She came to us for a shoulder issue, and she responded great to that. But when she started, she asked if I thought it would help her with her cognitive ability. And I said, well, there's clinics that use PEMF specifically for that and for depression and mental health. And I said, that's not what we're using it for, but there are some benefits. And part of the protocol that we use is we first do the heart and the thyroid, and then we do the brain, and then we do the kidneys and the liver to kind of charge those vital organs first. And so we told her that possibly when she's doing her brain, that might make a difference. And she responded great to the shoulder stuff. We talked about that regularly, but then she started telling me, like, hey, I'm sleeping better. I'm not feeling as cloudy. I'm feeling like I got more energy, and I'm not having that mental fatigue that happens when I'm trying to do certain tasks. And she did a treatment of 12, and on her 12th visit, she let me know. She says, hey, I haven't really said anything to you. She's like, but I've accepted a position to go back to work 6 months earlier than I thought I ever would be able to do. And I've seen her several times since then, and it's just been, for those two, getting them back to work, getting them back doing the things that they need to do was just very, very significant, stood out in my mind as being pretty awesome.
That is remarkably awesome. And I try to tell people that when you look at PEMF and you generally search it, it's the sports marketing, and people see the sports teams and, yay, I recovered from this injury faster, now I can play sports. And that is awesome. But the reason I think we're all involved in the technology doing it is cases like this, where somebody's life they're getting their life back, you know, and that is just remarkable to be able to have a hand in that and know that this person is now better off. It's an amazing feeling, and it's hard to describe. And I'm so glad that you guys are experiencing that. My next question was actually going to be, are there any results that you got that were surprising? And you answered it before I got it. So that's awesome. I want to ask you guys one question that we get from a lot from practitioners, because it's one thing to be able to bring in the PEMF and give people sessions. People, generally speaking, practitioners want to know how you go about charging for it. How do you charge the patient base for the technology, and how do you market it to them?
Yeah, so we charge a flat rate per session if they want to do that. And then if they want to, typically we'll have recommendations based on how acute or chronic the issue is or how severe it is, of how many visits. And so we usually recommend 3, 6, 9, or 12. The majority of those, we recommend 9 or 12. But if it's like a simple acute sprain or strain from the gym or from playing in a game, you know, sometimes 3 or 6 is more appropriate. Like with his patient that had the shoulder issue, within 6 visits, she was back to full range of motion, pain-free. So depending on how much they buy a package-wise, gives them a little bit of a discount on each one of those.
Sure. And we're talking, you know, this is a few $100 investment for, you know, depending on where we're at with that 3, 6, 9, or 12. And that the pricing, we found the packages have been kind of the best way to go about getting our patients on the device itself. And it's just such a meager investment when we put these things in context of what is the capabilities for healing with this device, and what are the alternatives. And the alternatives are just, we're talking thousands and thousands of dollars. And this is something where if you put a couple $100 investment into this device, we can make such a huge change. So we think it's a really affordable, awesome, high efficacious device that it's just been an awesome thing that we can add along with what we're already doing on the clinic side.
I mean, that is remarkable. And it sounds dumb to ask you guys this question, but I'm assuming you're not doing much marketing. It's more of getting people a chance to try the machine, and then from there recommending best practice.
And that's just it. It's one of those things that, someone will ask you, well, what is it doing, and what does treatment feel like? And it is a harder thing to give them the adjective they're looking for. It's something that we have found once you get on it, once you try it, you come try that trial. I don't know what the exact percentage is. We haven't put through the numbers, but I'd say a large portion of those people, they know they feel it exactly where their pain location is. And they really, it's got to be at least 3/4 of people that try it actually get a package, because that's how powerful that first visit really is. I mean, they know this is going to be working on what my problem is because they feel it.
Yeah. So typically when we're working with a patient, they have a condition or an issue, or they're not responding to the typical course of care, we'll bring it up to them. We'll say, hey, we've got this PEMF machine. We've got a little brochure. I want to give them this brochure, read through it. It's got information that goes through PEMF. And then we say, get online, read about it, learn about it, and then let's schedule you for a free complimentary treatment. We want you to be able to experience it yourself. And like you said, a high percentage of those that experience it, they feel it right away, just like I did when I met you guys at that seminar. Is it went right to the area of pain. They feel that same thing. The machine sells itself, but you got to bring it up to them. You got to get them to try it out. And so the best way we've been able to do that is by giving them a brochure, and then just encouraging them either on their next visit or on a separate visit altogether to schedule, get them in, do a complimentary course of care, answer their questions, make sure they understand how they're going to benefit from it.
I mean, you couldn't ask for anything more, and especially the way that you've described it and laid it out, it's pretty straightforward, and it's a matter of just following what the practitioner suggests, which is if you try the machine and you get results, here's how you use it. We have time for one last question, so I want to flip it the other way. And what's the one thing out there that maybe we haven't discussed or talked about that you guys want people to know about PEMF, about what you guys have seen or experienced the technology?
Well, for me, chiropractic isn't just my profession; it's my lifestyle. I'm looking for more natural approaches to do healing and heal the body from musculoskeletal complaints and a ton of other issues. The body is truly an electrical structure. It runs off of electricity. It creates gradients and charge. And so when we were first deciding whether this is something that we want to bring on, because it's a big investment, and if it's not something that's utilized, then it's just, it's just something else that's, you got another toy in the clinic that's not well utilized, and it's an expensive piece of equipment. But when I was thinking about it more and more, I was thinking, the body really does use electrical charge and creates frequencies. And it stood in my mind, the reasoning is if we can harness that electrical charge and frequencies to actually do self-healing, I mean, I know the body uses electricity ubiquitously. It uses it to do all of the work of cellular healing. So once I just started thinking about the physiology of how the body works, just more and more, I just thought this is something that, I don't have to cut people open. I don't have to inject anything. They literally just have to hold this device near their body, and we can really create a huge positive change. So I just think PEMF is such a cool technology, and there's good data on it. I think there needs to be more. It needs to be more, ubiquitous, and the lay population needs to really understand that this is something that can give you really good. It can give you the results you're looking for. It's got the side effects. There aren't big negative ramifications from doing something like this, and it can really change your life for the better. So it's just something that I think the technology is really it's unlike a lot of other modalities in healthcare. So it's just when I look at those risk rewards, and is it going to be efficacious? Is it going to do the thing I want to do? Is it going to, do I have to worry about X, Y, and Z for side effects? It just fits the bill on all of those so well, and it complements everything we're already doing in the clinic, physically working on things, working on soft tissue, allowing joints to move better. And now we've got this cellular healing component. It's just something that it really completes the circle for all of the tools in my toolbox to, somebody comes in, I know I can help them. As long as I get my diagnosis correct and we're really working on the right tissue, and I'm using all of the tools at my disposal, there aren't many things that are going to walk in the clinic that I don't have a tool for.
One of the things
totally what you said resonates with me. I just want to tell you, everything you said resonates with me. Sorry about that. Yeah, totally agree.
One of the things he mentioned was on a cellular level. You know, there's so many things we do as a clinician to help people heal better, to decrease inflammation, to decrease pain, to stimulate circulation. Well, PEMF is such a great complement to that, and it works at a cellular level. So most of the things we're doing, we can't affect a cellular level, but when you add PEMF to it, you can. So it's going to improve circulation. It's going to decrease inflammation. It's going to decrease pain, but it's going to increase the cell's ability to do what that cell is meant to do. And that's just something as clinicians we can't do externally, but adding PEMF to any of the protocols, any of the conditions, the cells are going to function more optimally. They're going to do a better job of what they're supposed to do, which helps with healing. It helps with so many aspects. So it's been great to add to the clinic. You know, even though it is not a cheap machine, it's well worth it. And you definitely, it's one of those things you get what you pay for.
Awesome. This is Josh Silver, founder of Pulsed Energy. I've had with me today Dr. Brennan Bates, Dr. Will Curtis, Better Chiropractic in Gilbert, Arizona. Guys, this has been awesome. What you have shared is remarkable, and I'm so thankful to have you guys as part of the Pulsed Energy family.
Awesome.
Thanks, Josh.
Thanks, Josh. Thanks for including us.
Thank you.